Welcome to Pulse and Pressors, where critical care gets crystal clear. Cardiac output is the foundational measure of cardiac performance, calculated as heart rate times stroke volume. It answers the basic question: how much blood does the heart deliver each minute? The formula for cardiac index is cardiac output divided by body surface area, and this will estimate whether the delivered flow meets metabolic expectations for that individual's size. But the BSA estimate is geometric, not physiologic. It does not account for oxygen consumption, mitochondrial function, illness severity, or shock. Cardiac output is a measure of performance. Cardiac index tries to approximate adequacy. They answer different questions and should never be conflated. Thermodilution cardiac output is computed from the temperature time curve after a cold bolus travels through the right heart. This method assumes stable, laminar forward flow. Severe tricuspid regurgitation violates that assumption by causing regurgitant washout, yielding a falsely low output. Intracardiac shunts divert the injectate unpredictably, making the curve unreliable. Extremely low cardiac output prolongs transit time and destabilizes the measurement. High PEEP or large respiratory swings alter venous return, widening variability in the thermal signal. Catheter malposition misdirects the injectate. Atrial fibrillation with rapid response produces beat-to-beat inconsistency in stroke volume, corrupting the curve. When physiology deviates from the method's assumptions, the computation ceases to reflect reality. Cardiac index equals cardiac output divided by body surface area often gets misinterpreted as a better cardiac output, but the BSA calculation itself is purely geometric. Using the Dubois and Dubois equation, BSA equals 0.007184 times, height to the power 0.725 times, weight to the power 0.425. There is no linkage to metabolic need or oxygen delivery. As a result, cardiac index can give misleading reassurance. A large patient may display a normal cardiac index, despite absolute cardiac output being insufficient for their metabolic demands, particularly in shock states. Conversely, a small patient may have a low cardiac index despite clinically normal perfusion. Indexing transforms the number, but does not increase physiologic accuracy. It is a mathematical adjustment, not a diagnostic refinement. In profound vasoplegia, SVR collapses. Because MAP equals cardiac output times systemic vascular resistance, the MAP can fall dramatically even as the heart increases its cardiac output. Cardiac index rises accordingly, creating the classic presentation of high-output septic shock. Despite cardiac index values of 4 to 6 liters per minute per square meter, the tissues remain underperfused because the link between flow and pressure has broken. In this context, cardiac index is misleading and sometimes dangerously reassuring. More meaningful markers include lactate, venous oxygen saturation, SCVO2 divided by SVO2, and especially cardiac power output, CPO equals MAP times cardiac output divided by 451, which reflects the hydraulic energy the heart actually delivers. Cardiac index tells you flow relative to size. Cardiac power output tells you whether the heart is generating enough energy to sustain perfusion. In vasodilatory shock, cardiac index can be impressive, while cardiac power output reveals catastrophic collapse. Cardiac index is valuable when pump failure dominates, but becomes unreliable when vasodilation rules. A high cardiac index does not guarantee adequate perfusion, and a low cardiac index does not always indicate shock. Elite hemodynamic interpretation integrates multiple metrics: cardiac output for pump strength, MAP for pressure delivery, venous oxygenation for extraction adequacy, lactate for metabolic stress, and cardiac power output for overall cardiac energy output. Cardiac index alone is not a destination. It is only one point on the physiologic map. True mastery comes from assembling the full picture, not elevating a single index to undue significance. This is Pulse and Pressors, reflecting on the marvels of the human body. Subscribe to stay sharp.